Hi, this year has been a very challenging one for all of us working in global health. But what has been so encouraging is that along the way, we met in paths so many organizations that wanted to collaborate for global health and for putting an end to the pandemic. So really appreciate all of the support and partnerships in Washington State and all the global health organizations here. Thank you.
Adara's biggest speed bumps were the impacts from the lockdowns in our communities, which made it difficult for mothers to access safe deliveries and care for their newborns.
One of the speed bumps we faced at Seattle Children's was executing clinical and preclinical work during a pandemic. I was really impressed to see how quickly and collaboratively we pivoted our research in light of what was happening globally.
Malaria No More's biggest mile markers, logged in Zoom miles of course, we're working as a global community to support countries carrying out more than 90% of planned malaria intervention campaigns, despite COVID, to avoid a potential doubling of malaria deaths this year. And we also launched a first ever National Malaria and Mosquito-Borne Disease Awareness campaign in India during monsoon season.
This April, SightLife held the inaugural convening of our Innovation Advisory Board to support our mission, eliminating corneal blindness. I met corneal experts from around the globe, from as far away as Ethiopia, Sri Lanka, Malaysia, and China on the 2020 journey.
We found joy this year in all the interruptions of our conference calls from dogs, cats, and children.
A major U-turn for me this year was realizing that one thing we don't have to mask is the fact that none of us really knows what we're doing and we're all just figuring it out together.
Hey chickens, how you doing? You know, since the pandemic started, I've been feeling cooped up just like you guys.
Yeah, global logistics hit a big speed bump when 90% of commercial flights got canceled.
I'm hoping that COVID-19 leads the global health community to unexpected destinations in the way we do our work in the future, such as less travel, more local leadership, and better care for people who have infectious diseases and chronic conditions.
The destination I found myself in this year, instead of going to Uganda, was in my living room, where I had to learn how to continue to build those relationships that are so very important to the collaboration.
We hit a speed bump when we could no longer bring people together physically for our events and conversations, our WGHA MO. But we adapted and found joy reaching new audiences through virtual events and seeing you show up, engage, and making new connections.
Oh, hey, WGHA. Hello, this is Chris Elias from the Gates Foundation. I think the Gates Foundation's joyous day this year was August 25th, when we joined dozens of countries in Africa for the celebration of the certification of the African region as wild poliovirus free after 3 decades of trying. So in the midst of a difficult year, we had one moment of great joy that we were able to celebrate with all of our partners in the Global Polio Eradication Initiative. Out.